This is an HRCT of a 74 years old male patient who had a history of severe trauma to the right side of chest. Now please observe these tubular configurations of bronchi, mild bronchiectasis. He had been a smoker. Similar tubular bronchiectasis in the medial and lateral segments of right middle lobe. Please see these dilated bronchi. Similar dilated bronchi are present in the basal segments of both lower lobes as well. Normally the bronchi, they are not traceable up to this periphery, but these are traceable quite up to the periphery. So there is mild bronchiectasis. Now these are the pulmonary contusions here, atelectatic bands and pulmonary contusions on right side. These are the pulmonary contusions here. Now there are multiple fractured ribs. They start from right fourth rib. Now this is the fracture involving lateral part of right fourth rib. Now this is the right fifth rib. Its lateral part is fractured as well as there is fracture of the anterior part. Sixth rib, seventh rib, multiple fractures. And associated pulmonary contusions. Now I will show you 3D. This is the 3D. The lesson to be learned is that we must always interpret the CT findings from the axial scans and not from 3D. This may add and facilitate you in the counting of the ribs, but actually, for example, this fracture line is visible here, although the patient had fracture of this rib as well as posterior end of this rib, but these are not visible on 3D scan. Now these fractures are visible here. This one. Now anterior end of this rib was fractured as well as this rib was fractured. These are picked up by the 3D. But these fractures, they are not picked up by 3D images. So it's always wise that we must interpret CT findings from the original axial, coronal and the sagittal scans.